So thank you so much, and it's just such a pleasure to be here. And I think good morning to all of you who are in Singapore and in Asia, and good night here from New York City. And most of all, wishing you a very happy World Toilet Day. So Jack, I'm really happy to be able to share maybe the newest baby in the World Toilet Organization family, which is the State of the World Sanitation Report. And I don't know if you know the background of this, but the conception of this report actually happened during last year's World Toilet Day event at the United Nations, which was of course hosted by the permanent representative of Singapore to the United Nations. And at that meeting, we decided that it was really a critical moment and crossroads for sanitation, where we were 20 years in from the start of the Millennium Development Goals, start of the WTO, 10 years from the human rights resolution was adopted for the human right to water and sanitation, but also at a moment where we're looking ahead 10 years to 2030 and trying to see how we're going to make this tremendous progress to be able to reach sanitation for all over the next 10 years. So that's really kind of what brought this report about. And so we really hope, and I'll share with you today some insights on this report, to bring some facts, to also bring these perspectives about the acceleration that's needed to reach those targets, but also some practical examples of how we think this progress can be made using case studies from countries around the world. So we're going to dive right in and give you some of a sneak preview into this report. Next. So why did we need a state of sanitation report? And I think as many of you have already heard, of course, the world is still alarmingly off track to deliver universal access to safe sanitation by 2030. And if we look at the current rates of progress, we would be in the 22nd century before sanitation for all is a reality. So clearly this is still too slow. And we've talked about the fact that sanitation itself is a human right and something that we need to provide privacy, dignity, and safety that must be physically accessible and affordable. But yet at this milestone, still too many people are living without sanitation services. Next. So when we look, and I hope you can easily see this, this graphic, but you can look at it more in the report. This is from the WHO and UNICEF Joint Monitoring Report, which is published in 2019, that looks at the progress that has been made from 2000 to 2017. And of course, the green are rates of progress, looking at people with access to safely managed and basic services, and then looking at the yellow and orange and deep orange, which are people who have access that is limited, unimproved, or open defecation. And so we can see that still 2 billion people lack access to even a basic level of service. When we look at safely managed sanitation, over half the world's population still use sanitation services that leave human waste untreated, threatening human and environmental health. And as we've talked about, there's been tremendous progress on ending open defecation, but we still have 673 million people who have no toilets at all and practice open defecation. And I just did want to point out, because sometimes in global figures, we can lose some of the inequalities and disparities, but we've been recently doing some work with the UNHCR, the UN High Commission on Refugees, and they have identified that only 32% of households of displaced people in camps and settlements have basic sanitation. So we can see that some groups are left behind. And one perspective I wanted to share, since we're talking about 2030, is that, you know, we're not just aiming to fill in all green. We're still going to have to reach up to 8.5 billion people with sanitation, which is still going to add an additional billion people to this progress. So the target is ambitious. Next. But when we look at this, we can see that poor sanitation has devastating consequences that the world cannot afford. We've talked about these: illness and disease, affronts to dignity, safety, and equality, the financial costs, and also, of course, really disproportionate impacts on the most vulnerable. And as a result of this, the world is not claiming the myriad of benefits that will come from safe sanitation. Next. So when we talk about safe sanitation, we just wanted to show you how toilets are, of course, the starting point and a first step in delivering safe sanitation. But we can also look at all the areas of the sanitation management chain that are opportunities to make sure that we can protect public health and the environment, from toilets to containment to transport, treatment, and finally safe use or disposal of wastewater or other fecal byproducts that can also be safely reused. Next. I think the report is oriented towards member states of the United Nations, and of course really makes the case, as was previously talked about, that sanitation is a public good and must benefit across the whole society for improved health and economic benefits. Next. So in the report, we have updated costing on the cost to be able to achieve universal access to sanitation. And we make the case that while it will be expensive to achieve universal access to safe sanitation, that inaction brings greater costs. And so the updated cost, which is shared in the report, estimates that the annual costs of capital and operations and maintenance from 2017 to 2030 to achieve universal sanitation will be $105 billion per year. That's broken down into basic sanitation and safely managed sanitation. But we also estimate that the economic benefits of sanitation are estimated at 5 times the cost. So this is a cost-benefit ratio that is even greater than that of water supply. So this is a really important point for member states. Next. So despite this excellent cost-benefit ratio, the funding still hasn't materialized for sanitation. And when we look at the recent report that's been put out by the UN Water and WHO GLASS report, we found that 80% of countries still report insufficient funding to meet their national sanitation targets. And fewer than half the countries reported that they can cover the costs of operating and maintaining sanitation systems through existing tariffs and user fees. So this is an important gap to understand in the financing landscape. So that covers the first half of the report. In the second half of the report next, we work on imagining a better future and looking at how dramatic acceleration can be possible. Next. So these are the acceleration curves that have been calculated to look at the progress that will need to be made to reach the target by 2030. And so you can see the first line with open defecation elimination in part, in a large part, because of the amazing progress that has been made by India. We are tracking on progress, but we know that not all countries are on track, and indeed have a number of countries where open defecation is increasing. So this will be an important one to keep up the pace of acceleration. But in order to achieve the rates of basic access, we will need to double our acceleration. And if we want to achieve the safely managed target, we will need to quadruple the rates of progress. So these are really the type of massive acceleration that we will need to create this big leap forward for sanitation. Next. So while the challenge is significant, history does show that it is possible. And in the report, we have 13 case studies that will talk about the progress that has been made, for example, in the 1960s and 70s by Singapore, Thailand, South Korea, and Malaysia that produced rapid and remarkable results to deliver total sanitation coverage. We'll also look at India that has created a mass movement which has gone a long way towards eliminating undignified and dangerous practice of open defecation. And we cover a whole range of countries that will provide some practical examples. And then finally, in the last part of the report, we talk about how we can accelerate progress next. With proven and effective approaches. And I know the time is running fast here, so I'll just run through them quickly and you can see more about it in the report next. But the 5 accelerators that will be used are following the SDG 6 acceleration framework that has been launched by UN Water at the high-level political forum in July, which covers governance, financing, capacity development, data and information and innovation, and looks at each one of these to see how it can unlock the potential for sanitation. Next. On governance, we look at how we can mobilize political commitment, leadership for effective coordination and regulation, that sanitation must be an essential service for which government is responsible and can be held accountable. It must have clear lead agency institutional arrangements and included across all of the policy strategies and plans. Next. The next accelerator is financing. We've already talked about that. So look at how smart finance can lay the foundations for services to reach the poorest and galvanize contributions from household and the private sector. Next. The third accelerator is capacity, and we know that people are absolutely at the heart of driving sanitation. We've seen this, we've heard this from Jack, and that systematic capacity development must be done for sanitation. We know that the low emphasis historically has resulted in significant capacity shortfalls across the system, and that a strong sanitation sector will require a much bigger workforce with better skills. And so we need to really prioritize investing in a diverse, addressing the gender gap in the workforce and really bring the best skills from our whole society to the sector. Next. The fourth accelerator is data and information. And for sanitation, as in so many other sectors, reliable data will better support decision-making and stronger accountability. And I think one of the things that we've seen with sanitation is when you can present that data about the scale of the need, the impact that it can have, you can be an effective advocate for the sector. So this is a big point that we make in the report, that we need to have that good data to secure the political commitment, inform policy making and decision making, and make sure that we can enable well-targeted investments to maximize environmental and economic gains. And then lastly, next, the final accelerator is innovation. And certainly innovation will lead to better approaches that will help us be able to leverage and scale up technologies and systems that will make sanitation accessible for rural areas, marginalized communities, and help us absolutely reach the most in need. And governments have an important role in enabling innovation through sound regulation, performance criteria, and standards. So next. So the last part of the report looks at this pathway to 2030. I know many of you are working on roadmaps to help your country reach this target. So we very much look forward to being together on this journey and looking at how we can leverage all of our capacities to make sanitation a challenge that we can solve in this generation. So thank you very much. Sanitation champions wish you a very happy World Toilet Day across the world. Thank you. And thanks so much, Jack. I really appreciate to be here with the World Toilet Organization. It's a huge honor, and it's just been a real pleasure to be able to bring the report, which, as I said, is very much inspired by this movement, to be here with you today. Thank you.
Thank you so much.